What does biological integrity mean?
Biological integrity is a term that we have chosen in order to remove the concept of gender and sex being confused with one another. So what we are talking about is the biologic sex of the child, which is determined at the moment of fertilization, that is the biologic sex and that there is not a capability of changing that no matter what the wishes or dreams of the patient are. So we're maintaining biologic integrity by respecting the biologic sex.
That means understanding that people operate best when they operate as a unified whole, mind and body integrity. And of course, what this refers to in culture is this big push we're seeing for transgenderism, which is actually an ideology. And a subcomponent of that, of course, is gender dysphoria, which is a diagnosis.
Basically, it means that the person, and in our particular field, the child, is comfortable and is functioning properly with regard to the sex that he or she was born with.
From a medical perspective, what are the harms of transgender interventions on children/adolescents?
Well, they come in three flavors. The first is the social affirmation, which is touted to be completely reversible, but which literally tears the fabric of the family apart, tears the child's social world apart as that child begins to pretend that they are a person of the opposite sex. The next is medical interventions, which start with blocking of natural puberty and then introducing the hormones of the opposite sex in extremely hyperphysiologic amounts that are known to cause disease states in the normal, healthy human being. And then finally, the surgical interventions, which create essentially a mutilation of perfectly normal body parts, creating a totally dysfunctional, asexual individual.
What we call transgender interventions, or what they call gender-affirming treatments, which are really transition-affirming medical interventions, is they're not proven to do what they're billed to do. They're not proven safe, they're not proven effective, they do not reduce suicides, and of course the chemical sterilization and surgical mutilation of a healthy body is not medical care.
Well, there's a lot of factors involved with that issue right now. Probably the most important factor with regard to kids with gender dysphoria, or this innate discomfort with their biological sex, is the fact that as uncomfortable as it is for both the child and the parents, as well as even the physician treating them, most of them actually will grow out of that particular discomfort after they've experienced puberty, which of course is going to happen with the vast majority of them. And so when that happens, then they may have other issues to deal with, and like many kids, they might already be dealing with things like depression, anxiety, etc. But that's a huge factor when we consider this whole situation, whether or not we should be treating medically or even surgically kids with gender dysphoria. When you think about the fact that, again, upwards of 90% will not have this gender dysphoria when they're finished with the pubertal process. Then it comes to the issue of decision making. And when it comes to kids, understandably, they don't have quite the same reasoning skills. We have laws regarding when people can and cannot buy legally alcohol, say, or tobacco, or join the service, or vote, or even sign on a will or something like that, or sign on something legal document. It's because in children, their frontal cortex has not been fully developed, and it's really not until late adolescence, early adulthood when that's the case. And so when we're talking about major medical decisions, things that can lead to significant side effects with medicines that are used, or life-altering and permanently life-altering situations such as sterilization with surgery, that's something that has to be, you have to be very confident as a physician that you're making the right choice. And lastly, just the studies are out there showing us that really we don't have a good handle on what is the best way to treat these kids. In fact, with the best studies we have, intense therapy, psychotherapy, mental health is where that is as well as any kind of medical or surgical avenue, the most success we're seeing. And so if that's the case, when we think about doing no harm, we really have to give a real pause to what our current standard of care is. It's based on something, unfortunately, very weak and not scientifically sound.
How should we distinguish good medicine from bad medicine when it comes to the effects of transgender interventions?
It's important to, first of all, call them interventions and not call them any kind of treatment, because treatment infers a sort of a beneficial outcome. The concept that these things done to children will make their lives better and improve their mental health is a fallacy. The data did not show that. The long-term data from Europe have come in after approximately 20 years of watching these kids and doing very critical studies of the evaluation of their mental health. It shows that there is no benefit to mental health and possibly a detriment to mental health in the long run to have these children believe they can be somebody of the opposite sex and to change their bodies both in appearance and physical changes due to surgical interventions. So it's a damaging medicalization of a mental health problem.
Well, fad medicine is almost always bad medicine, and these transgender medical interventions very much are proceeding like a fad and a social contagion, and we don't think they address the underlying problems that are always there.
With transgender medicine, just as with any medical topic, we have to weigh the benefits versus the risks of our interventions. And typically, in medicine, we want to do the least invasive things that we can, certainly things that would be less likely to cause side effects. With that being the case, to do no harm, it certainly would be most wise to do the therapies that will not cause any permanent problems for the kids, and certainly with children, that's a huge issue in any kind of medical intervention.
Have you ever helped a child or family walking through gender dysphoria or regretting decisions to undergo interventions?
Families that come to me pretty much already know that I'm not a proponent of doing the interventions that are commonly done to these children in the gender clinics in the United States. So I'm working with families that have a bit of skeptical aspect to their acceptance of this. And because of that, it's easy for me to lay out the scientific evidence that's in the literature that has been there for 40 plus years for us to draw on to show that what is best for children is based on clinical science studies that are verified, and that we use this as the basis for treatment. So it's easy for me to present this. It's hard for the families sometimes to accept it.
Yes, regret is there, and it's not rare. There's always a more honest way of dealing with gender dysphoria than chemical sterilization and surgical alteration of an otherwise healthy body.
Yeah, I've had almost 30 years of pediatric practice experience. Ironically, there's been very little of that in my practice, although I will say in just the last months, I've had perhaps one of my first patients to approach me with the terminology, as you're hearing more now, of feeling as if they are, quote, transgender. So it's an early part of the walk, I would say, but in the end, like I've mentioned before, with the psychotherapy and counseling being the best way to go, at this point you want to reassure the family that we're going to try to do what's best for the child and try to find someone in that field who feels competent that they can help the person. It's not always possible. I'm in a rural area of the country, and sometimes you have to go a little ways to find any kind of mental health help, much less that regarding gender dysphoria. But it's essential that regardless of what the problem is, if it's regarding any other kind of organ system for my patient, I want to try to find the best possible care I can. So reassuring them that we're going to do the best we can to find that care without causing any harm if possible is the most important thing I can do.
Can you speak to why unprecedented numbers of youth are seeking transgender interventions?
There's a conglomeration of things that have happened. The COVID epidemic and the isolation of children in their homes, separating them from their social environments, plus the always present angst of adolescence as children go through puberty, find that their bodies are changing and there are things that happen to them that they don't like, that they find abhorrent, not being accepted in social circles for any number of reasons, too tall, too short, too fat, too skinny, wrong color hair, things like that to the kids are extremely important. So when they find a place where they are suddenly accepted and given celebrity, this appeals to them for the moment, and their sort of confused state of judgment to say this is where I really belong, and they are accepted and cherished in these communities online. And the online presence, much to the chagrin of the trans activist community, online presence is exactly where these kids get this misinformation and hang their dreams on a false idol.
This is largely, at this point in time, being driven as a social contagion. It's a fad. And there's a lot behind that fad: the entertainment industry, the education industry. It's all over the web. Kids can't escape it. Young people with gender dysphoria need to be treated with what's called watchful waiting and strong psychological evaluation and support. And the reason is the overwhelming majority of these kids, conservatively over 85%, will desist in their gender dysphoria by adulthood. And the other reason is decades of literature showing the overwhelming probability of underlying mental health problems, adverse childhood experiences, and an unusually high percentage of kids in this group that have autism spectrum disorder. These things are best addressed with mental health and support, not chemicals and surgery.
I think it's a real good question, and I think that there's probably more than one aspect to the answer to that question, but one of the things that isn't talked about a whole lot is this potential for something called a social contagion. Now, in my practice, I've seen something called pseudo-seizure, for instance, where in a classroom there may be a child who has significant anxiety, panic attacks, whatever it might be, and occasionally that will actually present itself with something that appears very much to the naked eye to be a seizure. When the medical workup is done, and the EEGs are completed, and everything is looked at to try to rule out something truly neurological, often the diagnosis ends up being something called pseudo-seizure. Well, it's not uncommon in that same classroom to have a couple of other kids fall out with the same thing. Sometimes you may be dealing with somebody who's looking for a secondary gain. They want to get out of the classroom. But other times it's, again, this is something called a social contagion that actually is, they're almost sympathetic to it. Perhaps they're also dealing with some anxiety issues. Throw into that this relatively recent phenomena of social media, where these type of issues can be propagated not in a classroom, but in an entire country or beyond. And you can find yourself speaking with people who have perhaps similar problems like yourself, and maybe they're sympathetic to what's going on with you, but they also may feel like they're the expert or they have an answer for you. And when you're looking at nothing but success stories with regard to somebody who, in this case, with regard to transgenderism, this person with deep-seated disgust with their own body parts, say, is finding that other people are saying, look, I was successfully treated by going through this transgender clinic and having medicines and perhaps even surgery to resolve my problem. Kids, again, aren't necessarily making rational decisions based on that. Heck, some adults aren't making rational decisions perhaps when it comes to these kind of influences and peer pressures. So this recent social contagion that's no doubt exacerbated by the internet is a phenomenon that I don't think a lot of medical professionals are talking about as perhaps contributing to the fact that we've gone from, over the last 20 some odd years, just a very handful of transgender clinics per se, to literally hundreds of them throughout the country. That's got to be more than simply a medical problem.